Let's pray. Father, we thank you for today. Lord, we thank you for all that you have allowed us to do today and for the life that you've given us today and just for this opportunity that we have tonight to be together. Lord, we know that if we seek you, you will give us wisdom, Father. I pray for wisdom for our school board tonight, Lord. I pray for clarity. God, I pray that you would just rule and reign tonight, Lord. I thank you for everything that the school board does for our community, and God, for the way that you use them, and I pray you just guide them. Guide us all as we're gathered here tonight. Father, we love you, and we just thank you for allowing us to know you. It's in Jesus' name we pray. Amen.
Thank you. Next, we have Pledge of Allegiance. Mr. Hunt. Get the mic turned on. We have some special recognition tonight. Mr. Funderburg, I believe you're first.
Thank you, Chair McQueen, members of the board, Dr. Fisher. Just want to take a look around, make sure, okay. I'd like to ask the principal of Kings Mountain High School to come down, Dr. Dustin Moorhead. Each year, the Cleveland County Board of Education recognizes the high school that has the highest cumulative, unweighted GPA for all of its varsity student athletes. Several years ago, this award was named the Coach Jim Taylor Award in honor of the legendary Shelby High football coach and athletic director, Coach Jim Taylor. In Coach Taylor's role as football coach and athletic director, he strongly emphasized the role of academics to his players and coaches. While serving as the county athletic director, Coach Taylor began the role of recognizing our student athletes for their academic excellence. We are extremely honored that Coach Taylor has done this. The 2020-2021 winner of the Coach Jim Taylor Award with an athletic GPA of 3.41 is Kings Mountain High School. Congratulations to the students, teachers, and coaches at Kings Mountain High. And here tonight, as I said earlier, to receive this special award is the principal at Kings Mountain High School, Dr. Dustin Moorhead. Again, congratulations to all the Mountaineer student athletes, coaches, school staff for their focus on academics and emphasis on the student and student athlete. What a treat. Coach Taylor made it tonight. Coach Taylor. School board members' hands, and then we'll take a picture right here when you're doing it.
Here you go, Dr. Moorhead.
That's where we'll.
Coach, you ready for a quick pic? Here we are. Everybody's in. 1, 2, 3. One more. Let me slide over. Congratulations.
And for our next recognition, we have Miss Wendy Fitch.
Chairman Queen, members of the board, Dr. Fisher, thank you for the opportunity to recognize the accomplishments of one of our own, Terry Putnam. Terry was recently selected as the North Carolina One Community in Recovery Champion Award recipient for the Central North Carolina region. She was honored at the 2021 North Carolina One Community in Recovery Conference held in June. Recovery Champion Awards are given to individuals who have dedicated their talents to successfully promoting mental health and substance use recovery. Terry currently serves as a Project Activate Program Director for CCS. Project Activate serves to address the 3 tiers of mental health: promotion, prevention, and intervention, through a continuum of education, universal screening, and appropriate services and supports for all students in response to varying levels of need. As the Cleveland County Schools Project Activate Director, Terry promotes system-wide oriented change through multi-tiered system of support services to ensure that all students have access to programs and services that are matched to their individual needs and strengths. As a project director, she is working to develop sustainable strategies that can be scaled statewide to enhance mental health supports and services within schools. Terry also serves as the regional coordinator for the Southwest Regional Network of the North Carolina School Mental Health Initiative, which covers 10 counties. Terry has worked with CCS for more than 15 years, serving in a variety of roles, including District Positive Behavior Intervention and Support Coordinator, and Lead Behavior Liaison and Mental Health Coordinator. We are very fortunate to have Terry as part of our team at Cleveland County Schools, and we want to express our sincere congratulations to Terry for receiving this award.
Thank you. Now we'd like to recognize any guests that we may have this evening. Do we have any principals or assistant principals? Mr. Moorhead, anyone else? Do we have any teachers' assistants with us this evening? How about any teachers or NCAE representatives? Thank you for being here. Any elected officials? I didn't see any. And I'm going to include tonight, if you're a parent of a student in Cleveland County Schools, if you'd just raise your hand or stand. Okay, thank you for being here. Next on the agenda is adoption of the agenda. What's the pleasure of the board?
Second.
Motion by Mr. Fitch, second by Mr. Blanton. Any questions or discussion on the agenda? Those in favor, if you'd raise your hand. And that motion passes 9-0. All right, next item is public participation. We have 6 total signed up. That puts us just over our 15 minutes. If there's no objection, I'll extend the time so everyone can speak. All righty. Our first speaker is Amy Steele.
Mr. Chairman and members of the board, I stand before you tonight as a concerned resident, parent, and voter of Cleveland County. In full disclosure, I'm also a 22-year veteran of healthcare delivery. You may recall receiving a letter from me last week that I hope you've taken time to read. In the interest of time, I will provide you with updated information for your consideration. COVID cases are on the rise once again across the country, including Cleveland County. On Friday, August 6th, the North Carolina Department of Health and Human Services reported that Cleveland County had 312 new cases in the previous 7 days and 58 new cases just on August 5th. This all translates to a documented rise in the rate of new COVID cases daily, and it's getting worse, not better. On August 4th, Duke University School of Medicine professors and co-chairs of the ABC Science Collaborative warned that the 44 school districts that have decided to make masks optional may be flying blind as the Delta variant surges. As a result, several dozen children could die, they said. And even after Governor Cooper ended the statewide mask mandate, he is urging districts to mandate mask wearing in schools. Updated on August 4th, the CDC recommends the following with regards to K through 12 schools. Students benefit from in-person learning, and safely returning to in-person instruction in the fall of 2021 is a priority. Due to circulating and highly contagious Delta variant, the CDC recommends universal indoor masking by all students, staff, teachers, and visitors to K through 12 schools, regardless of their vaccination status. And many schools serve children under the age of 12 who are not eligible for vaccination at this time. Therefore, this guidance emphasizes implementing layered prevention strategies to protect students, teachers, staff, visitors, and other members of households, and to support in-person learning. Every year, our children are forced to take part in fire drills for fires that may never start. They practice tornado drills for storms that may never come. And they practice active shooter drills for domestic terrorists that we pray never arrive. If we do all these things to provide safety and security for our children, then why would we not take all necessary precautions to prevent the spread of COVID-19 and the Delta variant, which aren't what ifs or possibilities, but rather a clear and present danger that which we must defend our children from. The death of one child in Cleveland County due to COVID is too many, especially considering we have the means to prevent it. Your charter is clear. The second goal of this board is clearly stated on your own website. Help these students in safe, orderly, and caring schools. I encourage you to review the goals of this board and reconsider your vote on making masks mandatory in our Cleveland County schools. Thank you.
Thank you. Our second speaker is Ms. Nanette Leonhardt.
I was told nobody could hear me, so I'm gonna pull that mic down to maybe everybody can hear me. And sometimes I can hear you guys too. So anyway, I just need to hear you guys too. So I know that the CDC out of Atlanta is not even recommending masks for their employees. I don't know about vaccinations, but I'm here talking about transformative social emotional learning, AKA critical race theory. It is being taught in Cleveland County schools. So what the words will the left use to rebrand critical race theory? Transformative social emotional learning. When you see the words like equity and justice, that's pretty much, well, a giveaway. Social and emotional learning now being branded as transformative social and emotional learning, being taught right here in Cleveland County schools, has actually been around for a while, having been championed by the pro-left Nova Foundation, who are very pro-CRT. The Federalist article, How Social Emotional Learning Became Another Vehicle for Anti-White Racism in Schools, reported on how SEL becoming CR2 2.0 and warns parents accordingly. SEL is CRT under a new name, a game well played by the left. Parents, beware. On the off chance that CRT is not successfully rebranded as SEL, they have to call it something else. I suggest that parents be on the lookout for the following terms. More often than not, they lead back to CRT or that type of thinking. Of course, not in every instance, so judge carefully. Listen to the words: social justice, justice-oriented, equity, diversity and inclusion, systemic racism, white privilege, white supremacy, white fragility. These are just some. Inclusive, underrepresented. I have had meetings, 2 private meetings with some of you. Basically, I've been told, oh no, CRT's not being taught in Cleveland County schools. I digressed, it is. I'm ashamed of it. And I really want you guys to give the money back. That's all you have to do, give it back and remove CRT from Cleveland County schools.
Ms. Lenhart, I have a question. Do you have any lesson plans, any copies of any curricula, or anything that shows CRT being taught in Cleveland County schools?
CRT, are you asking about CRT? You
Yes,
won't find CRT in Cleveland County schools. You will find transformative social emotional learning.
But I'm asking, do you have any paperwork or any evidence that equates SEL to CRT as it relates to Cleveland County schools?
As it relates to Cleveland County schools,
Yes, ma'am.
well, all I know is I do research, and you know that, all of you know that. You have received my email August 3rd on this
Right.
very subject. All the links are there.
But there was nothing that applied to Cleveland County schools or showed anything about CRT in Cleveland County schools.
Well, let me ask you a question. Did you guys get funding from the federal government, and then North Carolina passed it on down here to Cleveland County schools?
That's, if you have any evidence of that being taught in Cleveland County schools, I'd appreciate a copy, and then we can.
Maybe a
discuss it more.
FOIA request is in order.
That'd be fine.
But I don't want to be sued by the teachers union like they're doing up in Rhode Island.
So, all right, thank you.
Thank you.
Our third speaker is Dr. Katie Borders.
Members of the Board of Education, my name is Dr. Katie Borders. I am a parent, physician, community member, and proud alumna of Cleveland County Schools. For reference, I believe the last time I spoke to you, the percent of positive cases in Cleveland County was 12.7% in December 2020. Currently, today, it is 16.6%. Our hospitals and ICUs are full. People are waiting for beds in the emergency department and sometimes being diverted to other facilities. There are children in the ICU with COVID. This is serious. The American Academy of Pediatrics, the North Carolina Society of Pediatrics, and the physicians at Shelby Children's Clinic all recommend universal masking. These are experts at the federal, state, and local levels, all agreeing on a plan to keep our children safe. I heard many, if not all of you, say last year that you wanted children to be back in school. This is now your opportunity to keep them in school. If we move forward with optional masks, with the current spread of the Delta variant in our community, we will inevitably be faced with positive cases in every grade, in every school, at least every week. If everyone in a classroom isn't masked, then all close contacts will have to quarantine, whether they wore a mask or not. This means that students and teachers risk being out for multiple weeks of the school year, even if they don't have COVID. It means we have students trying to navigate a virtual system that is no longer in place to keep up with schoolwork. It means substitute teachers who are unprepared to teach will be in the classrooms, and that's if we even have the number of substitutes we need. All of these scenarios are not ideal for our students that need to be in school. Please consider both the health of our students and teachers, as well as their education, as you make your decision tonight. I urge you to keep all students in school by requiring that everyone present on school property wear a mask. Thank you.
Thank you. Our fourth speaker is Donna Austell.
Hi, my name is Donna Austell, and I'm speaking today to address a few issues. I'm going to speak really fast to try to get through some things, and I'm going to cut off some of the things I plan to say that can wait till a later date. At the last board meeting in July, you voted 6-3 to keep masks optional for students and for teachers and staff. If you want your child to wear a mask, that's fine, and if you don't want your child to wear a mask, that's fine. I would like to thank all of you who supported that decision, because that was the most common sense approach to this issue of masking our children in schools with a virus from that has a 99.89% overall recovery rate. And all of us are already aware of the pitfalls of the children being in masks and their emotional and mental development. Now, one thing I'm going to touch briefly on, and I do thank you sincerely for making that choice. Everywhere you go, every county, every state you go in, all you hear is about the CDC. These numbers have changed, CDC says this, okay. Once you weed through all of that, people really need to stop. Who is the CDC? And do we trust these numbers that are being changed every day, if not every week? On July 21st, just a few weeks ago, the CDC quietly recalled the PCR test by the end of this year. That has been the test for the COVID vaccine or for the COVID pandemic. And basically, the article says, after you read through all the jargon, is that it can not tell the difference in many cases of COVID from the flu. Let me just say this, flu cases on average are 25 million cases a year. We had the lowest year in history last year. We went from 45 million cases a year to 1,455 cases. So if that makes sense to anybody, I'd like to know that. Something else I want to bring your attention to, there were 2 board members at the last meeting that chose to share their experience with getting the vaccine. And I admire them for that. I admire them for their courage in speaking publicly about their health issues. The 2 board members were Greg Taylor and Danny Blanton. Mr. Taylor said he made the personal choice to get the vaccine, and he in turn had to miss the June board meeting due to being sick with COVID after he was vaccinated. And we all know of people who's been vaccinated, unvaccinated, that are sick, that are very sick, not sick at all, no symptoms. So we've all run the gamut, I'm sure, with many patients. Danny Blanton shared his experience that he took the vaccine on the advice of his physician.
Ms. Austell, are you close?
I am close.
All right, about 2 more sentences.
And on the advice of his physician, now he has to deal with rheumatoid arthritis. So there are not any adverse effects associated with this vaccine. Now, to the 7 other members, one thing.
No, I got to call time on you.
7 other members on the board,
Ma'am.
you did not disclose your health care or whether you took the vaccine or not. And you know what? I appreciate that, because that's your personal choice and your right to not discuss that.
That's your
Thank you.
3 minutes. Thank you. Good. I hope I'm reading this name right. Next speaker is Marshall Allen.
Chairman and Board, thank you for hearing from me.
Can you raise the mic up, please?
Yeah.
Thank you.
Better?
Yes.
I'm a proud parent of a 6th grader, rising 6th grader at Kings Mountain Intermediate School. And I appreciate the vote you guys took last time on the choice to err on the side of freedom, to give parents the choice whether or not to mask their children. My son, as an example, last year during the in-person learning section, he would return home every day with headaches. I would return from work, tears in his eyes, him asking for Tylenol. I'm a bit emotional about it because I know what it did to him. To see him crying under the sheets of his bed, just head pounding, begging for fresh air, basically. It's a sensitive subject. I say thank you for the freedom. People that want to wear a mask, I don't care. They can wear a mask. I just don't want my child to wear a mask. It's nothing ideological. It has purely to do with his health. I just want to read a few stats. We've heard a lot of stats. I pulled some stats from the CDC today. They keep changing, as everyone says. The latest data here. Among cases reviewed, data were available for 41.9%, 8.9%, and 49.1% of cases for hospitalizations, intensive care unit admissions, and deaths, respectively. I'll make it quick, guys. Among children, adolescents, and young adults with available data for these outcomes, 30,229, that's 2.5%, were hospitalized. 1,973%, that's 0.8%, needed the ICU care. And 654, which is 0.1%, died, compared with much higher numbers with adults. Among children, adolescents, and young adults, the large percentage of hospitalizations, 4.6%, and ICU admissions at 1.8%, occurred among children 0 to 4 years of age. Among 379,247, that's 13.2%, children, adolescents, and young adults with COVID-19 on available data or underlying conditions, at least one underlying condition or underlying health condition was reported. That's 30.3%. No one's saying COVID can't be fatal. No one's saying it's not real. It's highly contagious. My whole family had it. Lots of my coworkers have had it. I've seen it spread to family, friends, whoever. It's a thing. It's going to be with us forever. I feel like it's the flu. I mean, we've been through SARS, we've been through H1N1, we've got this now, and unfortunately, we're stuck with it. I just ask that you guys and the board err on the choice of freedom. Just freedom for medical choice. We've heard a lot over the last few years about my body, my choice. And I just want to make a decision for my child that it's his choice and my choice to not have a mask. If other kids want to wear them, that's fine. If they're vulnerable, absolutely. If they're at risk for underlying conditions, absolutely. But thank you for erring on the side of freedom.
Thank you. Our last speaker is Megan Hoppus.
Good evening again, concerned mom here. I'm not going to bore you all with data and graphs and science because it is evident that a majority of our school board and a staggering 64% of our community do not believe in what the experts are literally placing in your hands to get through this pandemic. This old silly thing is 25 pages from Strong Schools NC Public Health Toolkit that was just updated 13 days ago, recommending universal indoor masking for all teachers, staff, and students and visitors in K-12 schools. That's neither here nor there, especially with this group. Tonight, instead, I thought we would play a little game that might help folks like you better understand our concerns. It's called Would You Rather? Rules are simple. 2 questions presented, and you have to pick one. That's it. For the game tonight, no answers required because I got 3 minutes, 2 minutes now. I've got to keep it moving. So here we go. Number 1, would you rather eat raw alligator eyes with every meal for 3 weeks straight? Or 2, have permanent orange Cheeto fingers for the rest of your life? Very serious. Number 2, would you rather serve on said school board and have to sit here and listen to these concerned parents discuss the safety of their children, or to be at home watching Jeopardy and Wheel of Fortune? See how fun this is? Some questions are easy choices. You're like, duh, number 2, who doesn't like solving puzzles with Pat and Vanna? Come on, guys. All right, keeping it moving. Number 3, would you rather require mask wearing in all schools to help prevent the spread of COVID and keep our children safe, or continue to keep this political? Whew. that took a serious turn, didn't it? All right, last one, but most important, so I do ask that you pay attention. Would you rather one unmasked child test positive and every single person that child came in contact with that's not vaccinated be sent home for 10 to 14 days? Or would you rather one masked child test positive for COVID and that child be sent home for 10 to 14 days? For that last question, I would almost bet my life that all 9 of you would choose the number 2, because I sat here and heard you say it for a whole year. The bottom line is, if mask wearing is not required, kids will not be in school. End of discussion. So do whatever it is you got to do with your Robert's rules and the pleasure of the board. I've been dying to say that. And get these children back in school safely and keep them there, because at the end of the day, that is all we really want. Thank you.
Thank you. All right, next item on the agenda is approval of the minutes of the July 26, 2021 business and closed session. That is, the business session includes a general account of the closed session. What's the pleasure of the board?
Move to approve.
Motion by Mr. Humphries. Second by Mr. Fitch. Any question or comments on the minutes? All in favor, if you'd raise your hand. All right, that motion carries 9-0. Second is approval of the minutes of the July 26 closed session minutes. These minutes will remain sealed because those were confidential matters. What's the pleasure of the board?
So moved.
Motion by Mr. Fitch, second by Mr. Shores. And since that's confidential, we won't have any discussion. Those that approve of the closed session minutes, if you'd raise your hand. Any opposed? All right, motion carries 8-1. Finance, well, we're on to committee reports, so we'll start with Finance and Personnel. Mr. Shores.
Thank you, Mr. Chairman. The Finance Personnel Committee met on Friday, July 30th. Excuse me. The meeting's called order. Dan Karpinski provided a finance update. The biggest portion of the update consisted of sharing information related to the budget for 2021-2022 school year. At this time, there's not an approved budget. Excuse me. There's not an approved budget from the state, and it does not look like a budget will be approved anytime soon. However, the state has given approval for school systems to plan and work at the same level they were at last year. Mr. Karpinski also updated the committee on the status of the district's ESSER funds. There was a discussion related to the allotment of ESSER funds for summer school and HVAC maintenance projects. It was mentioned as a reminder that all ESSER expenditures that required bidding be reviewed by Rob McDaniel, Director of Purchasing, prior to bidding to ensure compliance. Dr. Fisher shared information related to one strategic plan goals for the committee, which was to study the classified salary schedule. Specifically, information was shared related to the cost to the district if the hourly rate was increased to close to $13 an hour for some classified positions, which would align with the state budget proposals and draft budgets by the General Assembly. Mr. Karpinski gave an update of the end of the year 2021. The external audits in process. The audit is going well, and there's been no issues or exceptions brought to Mr. Karpinski's attention at this point. Mr. Karpinski also shared the state of Finance Department, explained the areas of work and organizations of the Finance Department. Ms. Wampler updated the committee on the current vacancies in the systems. The majority of the vacancies are in areas of teacher assistants and bus drivers. This is not in my notes, but I'm going to say it as I did the last finance summit. We are looking for teacher assistants and bus drivers. If you are interested in a position, please apply. Principals are working hard to get classrooms covered before the start of the school year for students on August 23rd. Ms. Wampler feels we are in good position staffing-wise at this time. No other business took place, and our next meeting will be August the 27th.
All right, thank you, Mr. Shores. There are no action items coming out of committee, but we do have our standard personnel report that's come before the board for approval. What's the pleasure of the board?
Mr. Chairman, I'll need to recuse myself.
Okay.
like do we have?
Hold just 1 second. All right, go ahead.
Are we gonna have any discussion on that committee report? Because I feel that on the state, on some of our county employees, they get local pay instead
All
of
right,
state pay.
hold right there just a second. Let's finish, because we got a motion and a second on the floor. Let's finish that part, the personnel report, and then
Okay.
if you've got a question on that, we
All
can
right.
address that. Any questions on the personnel report? All right, those in favor of the personnel report as presented, if you'd raise your hand. All right, and that motion carries 8-0. Now, you have a question on that?
Yes, on Mr. Kapinski, he was talking, and I've done a little checking. We have, especially our maintenance employees, a lot of them are on our local pay instead of state pay, but they're on our state retirement. And by my understanding, they've been told by them being local pay, they will not receive that extra pay. In other words, that we pay them what we want to pay them, as far as, I guess, that minimum wage. And I feel like they're state employees too, in a sense, because they're on a state retirement. They should receive what our other employees is getting, and that's just as simple as that. And I just needed to bring that out because our maintenance boys, they deserve, or anybody that's on our local pay, if we're going to raise the minimum wage up because of what the state does, then they should be getting it too, because they're at the end of the day, they're state employees too, because they're on a state retirement.
Dr. Fisher, do you have anything to clarify that?
That's really not how that works. That's, Ms. Blanton, that's a misconception and not really accurate. We do have state funds and local funds. We have federal funds. But when we set a rate of pay for a job classification, that rate of pay for that job classification is the same regardless of whether that position is paid out of state funds or out of local funds. We have teachers that are paid out of a state allotment. We also have teachers that are paid out of local funds because we employ more teachers than the state allocates for us. We have teacher assistants in a very similar role. We have central services. We have classified folks like, bookkeepers and data managers at our schools that are more than what the state would allocate. So the idea that the state would raise the pay, and because somebody is paid out of local funds, they would not receive that, it's just not accurate. It's based on their pay scale and the pay grade that they're at. If the state says, for instance, and just because they've done this in the past, they said all employees get a 2% raise, well, that would be everybody get a 2% raise, regardless of whether you're paid out of state funds, local funds. It really doesn't matter necessarily the funding source. It is if all employees get that, then all employees get that. If they move, if the state would say, okay, we're going to give teacher assistants X, then it would go to that classification of teacher assistants. So it's really not broken down to the extent that you're talking about from the state, local, and federal dollars.
Or do we need to be talking to the state? Because by what I'm hearing, that there are some difference there on that. Do we need to make some adjustments on that or talk to the state on that local?
Well, the state doesn't have anything to do with the local funds. We get those local funds from our county. We appreciate the support we get from our county manager and county commissioners. So those are we pay out of local funds. We pay employees above and beyond what the state allocates. If the state gives us X number of teachers, yet because of having 29 schools and because we want the lower class size and do those things, we hire an additional 150 teachers, then we can pay those out of other state funds. We don't just take teachers out of the teacher fund. We take them out of DSSF. We take them out of other Title II, Title IV, Title I, all these types of different types of funding, not just local funds. So it all goes into the mix. But there is an established teacher pay scale. There's an established teacher assistant pay scale. There's an established custodial pay scale. There's an established pay scale for every job that we have. And if we have a new job, then we create a new pay scale. So what happens is and we discussed this in committee, if we go back and adjust a pay scale, then if the state doesn't fund that adjustment, that comes out of local dollars. If you remember and I'm sorry, I'm going along with this, Mr. Chairman. You can feel free to
good information.
hit the gavel and send me back to my chair if you want. But if you remember a couple months ago, we gave bus drivers $1 an hour more. And so we did that out of local funds. Those are local dollars that we did that. We didn't say, okay, well, we got X number of state dollars, and if you're lucky enough to get it out of the state fund, you get that. And if you're a local bus driver, you didn't get that. No, it goes for everybody. So if we decide to do that with, let's say, our teacher assistants, and we decided to change the pay scale for teacher assistants, it doesn't matter whether we pay it out of the pot of money that we get from the state, or the pot of money we get from Mr. Epley and the commissioners, or we pay it from a pot of money that we get from the federal government and Title I, Title II, or any other opportunity we have. We establish that rate of pay, and that rate of pay goes for everybody regardless of the funding sources. Now, years ago, people used to get different colored checks and all that kind of stuff, but that's gone. I mean, even then, the process was the same, but the employee knew that I got paid out of state funds or a mix or whatever. Employees don't know and honestly don't care. As long as at the end of the month that money goes in their account, they really don't care if that's a state dollar or a local dollar. It spends the same at Walmart or wherever. So it's irrelevant there. So if you have questions like that, we can help with employees to clear up any misconception. But that's really not accurate.
Okay. Did you have a question?
Yeah, as the chair of the finance committee, Mr. Blanton, I want to assure you that there's some things that we need to talk to the state about. Number one, they need to get a budget, which I don't think they're ever going to do. And number two, some of their laws are crazy. And I'll just say that. For instance, the reason we had the bus situation was the state limits us on how much we can pay a bus driver. And I was outraged. We had one bus driver that had driven a bus for 20-something years. And the state said we couldn't pay them $1 extra an hour. Well, what do? We found it in local funds. And as chair, I'm committed to making sure that everybody across the board gets the same. But if you want to talk to the state, talk to them about getting a budget put together. That would help the finance and Dan Kopinski a whole bunch.
All right. Thank you, sir. Educational programs, Mr. Humphries.
Mr. Chairman. Educational Program Committee met on Friday, July the 30th. Carla Terry presented the Head Start Program Information Report to the committee. This report was for informational purposes only, and the information has been forwarded to the entire board. Wendy Fitch presented information on the Evergreen contract. Evergreen is the company that evaluates one of our EC grant programs. The proposed contract is part of the NCSIP grant. The grant is starting a new 5-year cycle. Due to the amount of the contract, this contract does require board approval. The only issue we have ever had with the contract with Evergreen is having to hold the invoice if the money is not in the account from DPI. The money for the contract evaluation is part of the grant, and the grant specifies that we use Evergreen. There are 2 contracts, one for the current budget and one for the carryover. The committee supported the recommendation of the contracts, and they are on the board agenda tonight. Dr. Hunnell highlighted the Jim Taylor Award, which we had just earlier, so I won't go through that. Dr. Hunnell and Tamara Goforth presented the IXL Learning invoice to the committee. This is for add-on licenses for reading, math, and science, K-12. The committee engaged in a discussion on cell phones and discussed information in a meta-analysis article. Cell phones are seen by some staff as a distraction that takes away from the instructional focus. Students cannot get on the district's secure network with their personal devices. There is a policy in place, 4220, that addresses cell phone use. A recommendation was made to update the wording of the current policy to include the wording instructional setting or instructional time. This recommendation will be part of the full review by the policy committee at our next policy committee meeting. It's policy 4220. The committee discussed policy 4720 in student surveys. The purpose of this discussion is to bring awareness of the policy and the relationship between surveys, curriculum, and student learning. Additional information and discussion may be needed on this subject. With no new business, the meeting was adjourned.
Thank you, Mr. Umpers. There's one action item coming out of the educational programs, that is for the Evergreen contract. And as I understand, there's a not to exceed amount on that of $78,000. So coming from committee, it needs no second. Are there any questions or discussion on the Evergreen contract? All right, all those in favor of in favor of the EC Evergreen contract, if you'd raise your hand. All right, that motion carries 9-0. Operations, Mr. Bland.
Yes. On our Operations Committee, we met on Friday, July the 30th. The meeting was called to order. Dr. Fisher updated the committee on the process of our faculty's assessments from Macmillan and Plasman and Smith and MPS. The workplace was beginning at the Quicken, and representatives from MPS were scheduled to visit the schools in Kings Mountain and Shelby attendance areas in the coming weeks. Several of the visits have already taken place, and MPS will provide an update at the August committee meeting. Dr. Fisher updated the committee on some work being done at North Elementary. This work is being provided by someone in the community and will enhance the property and allow better access to the walking track and the play field. The CCS Maintenance Department is involved in coordinating the efforts and ensuring the compliance with the district's priorities. Dr. Fisher updated the committee on two pieces of property that either the district is interested in selling or someone has expressed interest in purchasing. The house owned by the district that is behind Grover Elementary is no longer being used due to various reasons. It is not included in the future use plans for the school. The district and staff members are interested in attempting to sell the house. In addition, the district has been approached by members of the community about the potential purchase of the old central school in Kings Mountain. Currently, the Division II maintenance uses the first floor, and Partnership for Children uses part of the second floor and the third floor. After the discussion, the committee recommended to direct the superintendent to begin the process of potential of selling both properties. The recommendation from the committee for the board approved is to authorize the superintendent to initially begin the beginning stages required to sell the house behind Grover Elementary and the old central in Kings Mountain School. Then our next topic was Jennifer Wantner and Chip Childers provided an operations update and included a monthly capital project report. The capital project report included in the board's information for tonight. A list of surplus items from the CTE and the maintenance was presented to the committee for approval. In addition to the CTE and the maintenance items, 3 mobile units were discussed as potential surplus items. The committee recommended that the board declare the complete list of the CTE and the maintenance items, as well as the three trailers as surplus to be sold. Mr. Childers provided the committee with some request information related to the pool repairs at Shelby and Kings Mountain High School. The athletic lighting survey that was performed at all 4 high schools was discussed, and the committee reviewed the results. Dr. Fisher and Ms. Wantner gave a quick auditorium update, and Holland and Hammett are continuing to work to finalize the drawings. And I'm going to go back to the 3 mobile units. They were at number 3 school as 2 mobile units and 1 bathroom unit.
All right. To finish out the Operations Committee report, Mr. Weiss presented a proposal that would allow CCS to engage in a technology buyback initiative and sell our used technology to a vendor. Mr. Weiss and the technology team worked through their buyback proposal and are recommending Diamond Assets to contract with for the buyback of our used devices. They have guaranteed a minimum value of the devices at $270,630 with a potential value of up to $388,255. I'd explain all that. The company takes the devices in, they grade those A, B, C, and D, and then you get a value based on that grading. The Operations Committee approved the proposal and will recommend to the board for approval. Ms. Brown gave an overview of the Child Nutrition Program. She highlighted the work that's been done over the summer, repairing coolers and buying furniture, and felt good about moving forward into the new school year. Ms. Brown is concerned about the child nutrition workforce, and other members of the administrative staff agreed that staffing is a challenge in all areas. The meeting was adjourned, and the next Operations Committee meeting is August 27th. So we have a couple of items for action. First is the surplus declaration. You have those items in your board docs, and that is coming from committee as a recommendation for approval. Are there any questions or discussion on those surplus items? That will include the CTE maintenance items and the 3 trailers. All right, those in favor of declaring those items surplus, if you raise your hand. All right, that motion carries 9-0. The Apple buyback proposal, you also have that in your board docs, and that will be purchasing our old equipment for a minimum value of $277,000 and some change. That is coming from committee as a recommendation. Are there any questions or discussion? All right, all those in favor of the buyback proposal, if you raise your hand. And that motion carried. And we have 2 pieces of property. One is a residential property behind Grover School that's no longer used, and the second is the old Central School in Kings Mountain. That's coming from committee as a recommendation that we start the process. We've not, that's getting surveys done, appraisals, things of that sort, so that we'll know what the value of those properties are. If we get any offers or whatnot, it'll come back to the board for approval on that. Any questions about those 2 properties or starting that process? All right, those in favor of starting the process to sell those 2 properties, if you'd raise your hand. And that motion carries 9-0. All right, next is policy. I don't believe that committee met, so there's no report, but we do have a few policies. Let me get straightened out here. We have several policies for approval. They were on our list last time as first reads. So we have policy 3160 is moment of silence for full board review. 3460-E is early graduation application. 4304E is notice of use of unreasonable restraint, seclusion, or adverse procedures. 6430-R is purchasing requirements for equipment, materials, and supplies. 2130 is board member compensation. 7426 is contracts for licensed personnel. Are there any questions or discussion? This coming from committee recommending approval. Any questions about any of those?
Wait a minute. 6430, was that in that group, or is that in the first read?
No, that's in the group for approval.
I'd like for it to be separate.
Okay. Any other questions or comments?
Well, the 6430, that is on purchasing and the money and stuff like that. I've been against the purchasing numbers that we put out there. That 90,000 was cut, the 99,000 was cut to 75,000. I've been against it, and I'm still against it. And so it's still the same. So I'm still against that policy, 6430.
All right, we'll pull 6430 out and do that first. So policy committee is recommending approval, needs no second. Any further questions on 6430? All right, those in favor of 6430 as presented, if you'd raise your hand. Any opposed? And that motion carries 8-1. Is there any objection to taking the other policies as a group? Okay. I'll read those numbers. 3160, 3460, 4304, 2130, and 7426. That's coming from committee as a recommendation for approval. Any questions? All right, those in favor of those policies, if you'd raise your hand. And that motion carries 9-0. And then for information, you have 3 policies for first read. That's 5121, disposal of confiscated weapons, drugs, and alcohol. Policy 7730 is employee conflict of interest. And 7730-R is employee self-report of secondary employment. So those are there for first read. All right, next is safety, and you guys did not meet?
No, we
Sunday?
canceled.
Okay. All right, so no report from the safety committee. Next is our superintendent and COVID update. Dr. Fisher.
Thank you, Mr. Chairman, members of the board. We'll quickly go through some of this information here. You've got a copy at your chair. Had a little bit of updated information after I made those copies, and so the PowerPoint that you have on your computer and the one on the screen is slightly different, a couple slides, and so make note of that. Just a couple things, and I've mentioned this before, but the good thing about where we're beginning school this year is we did get back into school last year, going 5 days a week. I think that we understand how we're going to go 5 days a week. We understand a lot of the protocols with everybody in the building. Obviously, when we were in Plan B for the first 2/3 of the school year is a little different. Now that we went to Plan A for the last, for high school and middle school students, really the last 6 or 7 weeks of school, and for some of our elementary school, almost the entire last 9-week period, we're able to do things with the entire building like modified lunch and had the entire school building in there with no congregate grouping in the morning and afternoon. So our administrators and our teachers understand what that is going to look like and how to do that. In many ways, the way we did school in the spring really translates to the way we're going to do in the fall, with a lot of the protocols that are in place, a lot of the layers of prevention with that. We had hoped that we could even relax on some of those other protocols. Unfortunately, as we thought, as we started the summer, we really thought we were going to be able to. But as I get to in a minute, unfortunately, COVID data is trending in the wrong direction to be able to do that. So we'll start school with many of those protocols in place. Graham Elementary, Early College High School, as you know, has started school. Graham started school on July 17th. Today was the beginning of their 4th week of school. I did have the opportunity to visit their school again today. Lots of really good things going on, teachers teaching, students engaged, learning. I will say a majority of students at Graham were wearing masks today. I didn't take up the poll count, but I would say between 75%, a lot of the students were wearing masks. It was a mix there. So the early college started last week. They just went to school 3 days a week last week. We've have had one confirmed case of COVID at Graham. With that one case, we did have some contacts because of lunch. The early college, we've had a positive, but it was a non-school day prior to school activity that created that positive case. So we've gotten off to a good start at both Graham and the early college. Currently, as you've heard tonight, and as you know, I've sent you the information, our current Cleveland County and CCS COVID data. I mentioned Graham and early college from a CCS perspective, but our county data continues to trend in a negative direction in terms of increased COVID cases. And you see that, you've heard about that on the news. Don't need to go into more detail there right now. Just kind of a couple things on your radar, and I know you're aware of this. This Thursday is the first teacher work day for our traditional schools, the 27 schools outside of Graham and the early college, and school starts for students Monday, August 23rd. So we're just right around the corner on that. Excited about the opportunity of school starting. A couple things that we get a lot of questions and want to make sure we clarify as we talk about layered strategies to prevent COVID spread. A couple definitions, and this is stuff that we deal with a lot, just to hopefully clarify. A close contact. What is a close contact? A close contact is someone who is within 6 feet for 15 minutes or more, and that's a cumulative 15 minutes. If I was around you for 5 minutes, and next, an hour later, it's 5 more minutes, and then 2 hours later, we were together 10 minutes, that's 20 minutes of cumulative time, so we consider it a close contact. Of someone who tests positive for COVID, and either party was unmasked. And that's the important part. If all parties are masked, then that's not considered a close contact. But if either party is unmasked, that is considered a close contact. The close contact tracing window is 48 hours prior to a positive COVID test or symptom start date. So if we have a positive COVID test on Monday, and that was just because of a person tested, maybe because they were going to have surgery, or maybe it was because of something different, and they test positive, we go back 48 hours prior to that. If they tested positive on Monday, yet they started feeling bad on Friday, then we would go back Friday, 48 hours prior to the onset of symptoms to look at that contact tracing window. Appreciate it. I know Ms. Hanson's here. Her team of school health nurses and folks at the health department do a tremendous job of helping us with contact tracing. Lots of conversations many times in the evenings or on the weekends to help make sure we are doing a good job with that. Given the current mask policy per our board meeting last 2 weeks ago, masks are currently optional for students and staff, and I've communicated this to our principals and staff and board members, but I want to make sure publicly to remind folks that currently masks are required for drivers and riders on our school buses transportation. That's all school transportation. That's shuttles. If we're shuttling students we do a lot of shuttling between one of our schools and the early college or back and forth. That is required. That is a federal mandate, not an opportunity for us to make that decision. That is something that's mandated by the CDC. So that is required for all drivers and riders. I've got a lot of information on the next 2 slides, and I'm not going to go into that. You can read that. But you have that for your knowledge. We get a lot of questions about quarantines. Why does this person have to quarantine? Ms. Green and I, we've talked several times about, and some of it is because situations are different. And now we've added in another layer of vaccinated versus unvaccinated. So we've got 2 scenarios here. We've got a close contact that is vaccinated. If you're a close contact and you're vaccinated, you will have to wear a mask. You don't have to quarantine, but you have to wear a mask until you either get a negative test or for the duration of your 14 days. Again, that's highlighted in that chart. I'm not going to read that to you, but just want to make sure you're aware of that. As you hear about close contacts, you can refer back to that chart and look through that. As that updates, we'll make sure we continue to update you with that guidance. The next line that you have is close contacts of non-vaccinated situations. And again, if you're a close contact with a non-vaccinated, that's very much similar to what happened last year. And again, if you remember going back to one of my slides, it is, if you're a close contact, it's if either party is masked. So if two students are both wearing a mask, then that does not consider a close contact. If they're not wearing a mask, one of the two is not wearing a mask, then that does classify as a close contact. A long list of things, and I know when you look at this long list, you're like, oh my, I better get comfortable. He's going to go for a while here, but I'm not. I'm going to really quickly go through that. Health screenings, attestation forms. We had them required last year by the state. They are not required. However, Cleveland County Schools are requiring them this year at the elementary and intermediate school. That is because with the policy of masks being optional, we want to understand and know what the parent intent is. And once we have a parent's intent of the mask, and we can help to emphasize that with those students. Middle school and high school students, obviously we need to continue with health screenings, have parents help us with health screenings. If a student is becoming symptomatic, does not feel well, they do not need to come to school. But the middle school and high school students, if their parents want them to wear a mask or wear a mask, it's their responsibility to wear the mask. Our elementary and intermediate school students, we want that teacher to know and that staff to know so we can assist and ensure that those students are masked if that's what their parents choose. We did continue to employ school health technicians. As you know, we have school health technicians in all of our schools. That's a valuable resource as we continue to remove students that become symptomatic and also deal with contact tracing. They are another line of defense with our school health nurses. Water fountains are still off limits. We do have bottle fillers in many of our schools. Water fountains will remain off limits. School and physical distancing, we continue to emphasize that to the extent possible. Our transportation, I've gone over that, and just to hit that point again, masks are required on all transportation. Arrival dismissal, if you know, many of our schools, a lot of times when students get to school, they'll go to a common area, whether it's a cafeteria, whether it's a gym, and wait till class dismiss. And we are encouraging and working with our schools on plans not to incorporate that. We don't want to have areas where a large number of students gather. So students, when they get to school, they'll go to class. Just a change of the way we do business in the morning, but that does help to mitigate potential spread of COVID and not assembling large groups of students together. School and classroom cleaning, we'll continue to do that, continue to emphasize that, especially the areas of high touch. We know a lot more about COVID. We know a lot more about the spread of COVID than we did when we started school last year, but we do want our school staffs, our custodians, our teachers, bus drivers to continue to hit and clean, especially in those high touch areas. Remote instruction, I've gotten asked a couple times, are you going to have remote instruction? And we understand we will, regardless of the situation, we will have some quarantines. And so some remote instruction will have to continue to go during quarantines. We're going to have students that are going to miss that. So remote instruction is just not gone away. But for our traditional schools, remote instruction will be for some of those quarantine periods. For students that are interested in full remote instruction, no face-to-face, then we do have Cleveland Innovation. Right now we have 125 students enrolled at Cleveland Innovation. So that is the full remote, fully online school. But our other schools are full in-person learning. But understanding that if and when we do have some quarantines, we will have some remote learning that we'll need to continue to do. Quarantines, you've got two slides that give lots of situations around quarantines. We will continue to have quarantines. If you remember, I said we had one positive at Graham and had 6 close contacts that had to quarantine, and that was during lunch. And so even though at that time it was still under the mask mandate and they were wearing a mask, it was during lunch, and so we still had some close contacts. School functions, things like athletics, we continue to follow the guidance by the High School Athletic Association. Next week we'll have things like orientations and open house. We'll have people in our buildings. Our principals are really making plans to make sure we mitigate potential spread. We're not having, not having assembly areas where all parents come in and hear the principal. They're trying to spread that out, making sure we have physical distancing and social distancing is being able to be used. We strongly encourage parents to when they come to orientation, to wear masks and not to come if they are feeling bad or don't feeling well. We can do some orientation. There's lots of things online. We don't want to start school in a situation where we have people quarantined. So we just ask that our parents really respect that with orientations open house. Field trips, we're looking and taking field trips from an individual standpoint. A lot of our field trips we put on hold. Some of our field trips, because of where they're going and how it's happening, we can accommodate and do the same practices at the field trip than we can at school. It just depends on what those are. So we're looking and evaluating all those, but a lot of our field trips will be postponed until our COVID data is better. Visitors, non-essential visitors are not going to be able to come to school during the school day. We do have some essential visitors, some things that we will need to do. Unfortunately, though, we'll not be able to meet the need of all those visitors. Especially at lunch, we have a lot of visitors who want to come at lunch, and just because of the potential spread that may be encountered there at school, we will limit the visitors at our school. We do have some information that continues to come about the use of testing for diagnostic and/or screening purposes. And let me emphasize that any testing we do, if we would be for a student, would have to have parental consent. We would never test a student for COVID without parental consent. If you remember, we did some testing last spring with partnership through our telemedicine partnership with Shelby Children's Clinic and Atrium Health. We did some on-site testing there. We listened to a webinar right before we had a closed session today about opportunities for diagnostic and or some screening purposes. But again, that is really any version of that for students would have to be with parental consent. A diagnostic would be from a symptomatic standpoint to be able to ease and make that more convenient for parents and students to get that testing and get quick results there. And then vaccine availability. I know that I've talked with our partners at County Health Department. Vaccines are available. Encourage people to participate that if that's their choosing. At last spring, we did have vaccines available at our schools, especially at our high schools. We will continue to have a vaccine clinic, work with our health department to offer that. Again, that anytime a student would have to have parental consent to be able to take that vaccine. And then just a couple points to finish up, regardless of the mask policy. And again, this is, I think, the third time I've said this, but I just want to make sure we get that information out. Regardless of the mask policy, all passengers and drivers of school transportation must wear a face covering, a mask at all times. And so we will be prepared with masks on the buses. If a student doesn't ride the bus in the morning, goes to school, and they, under the current policy, they choose not to wear a mask during the day, they get on the bus to ride home, we will have a mask available for them to put it on so they can make sure to do that. But parents need to just remember that students are required to wear that mask on the bus. And again, that's a federal CDC regulation. Teachers, staff, and other students should perform self-monitoring of symptoms and do not report to work if sick. I think that this is a huge piece of helping to slow the spread of COVID in our schools. Too many times, we have people that come to work, and I know this happens not just in our business, but another business, and just feel like, I don't feel right, don't feel good. 2 or 3 days later, it gets worse, and now we've got COVID, and we've got lots of contacts. People need to self-monitor. We need the help of parents, grandparents, guardians to help monitor symptoms from students, and if they're not feeling well, not to come to school, to communicate with their healthcare provider and get good advice before they're coming back to school if they are symptomatic. And then again, hitting the contact tracing again will occur for anyone 6 feet or closer for more than 15 minutes of cumulative time per 24-hour period if a positive case is if anyone is unmasked. And this includes classes where the positive case attends, hallways, groups, extracurricular activity, bus, lunch, etc. All that stuff goes in there. So just wanted to reiterate that. There's some, misinformation, I think, that many times circulates about who has to quarantine, who doesn't have to quarantine. But this is cumulative 6 feet or closer for more than 15 minutes in a 24-hour period, regardless of either one of those are masked or unmasked. And I appreciate the fact that our partner at the health department, Tiffany Hansen, is here. And so I'm going to ask Tiffany to come up and share a little county data with you. And I think they're going to switch the PowerPoint.
Mr. Chairman, real quick, Dr. Fisher, just one clarification. I believe the school buses is a requirement of the United States Department of Transportation.
Yes, I think that's ultimately where it comes is from there, and then it translates into the CDC. But yes, sir, you're exactly right. I put a document on your places about the documentation of that requirement for the school bus transportation.
That was my question. I was going to ask you. I wanted to see the documentation from that great gentleman upstairs.
That's in your packet.
In this.
No, sir. If you look, there's an article, a printout from the CDC.
It's this one.
Maybe Mr. Shore's got yours.
It's there.
Okay.
All right. Any other questions before Tiffany comes?
I got one.
Yes, sir.
One question. With the, if teacher or staff was in quarantine last year, we had COVID money to take care of that. What's the results of that this school year? If they're in quarantine and can't come to the workplace, or is there COVID money in place to take care of them, or are they going to have to take sick time?
Well, so last year, basically there was COVID leave, and that was provided. It was state, federal leave provided from the government. There is still contagious disease leave. At the state and federal level, they have absolved the COVID leave. So there is, from the state and federal government, there's no more COVID leave, but there is contagious disease leave that they can take. Jennifer, do you want to add anything?
They can take it if they're a close contact and have to be quarantined, or if they tested positive. So our staff will work with them to make sure that they're not burning their sick time if they are quarantined during that time.
That's correct. Because that is not, they did not take sick days for that.
All right, thank you.
It's sort of the same thing, Mr. Glover, of the COVID leave and contagious disease leave. It's a little bit different. We have a great relationship, and I appreciate Tiffany and all that her team does. And we have a great relationship because of the quarantines, and I believe I'm right on this, I think to offer contagious disease leave, there has to be a communication here. And so we've been able to communicate so well that when we have quarantines, they verified it. The reason is obviously you don't want somebody to say, oh, I'm quarantined, and just be able to take days off. But we have such a good relationship that we're working together on all those cases to make sure. And we do want to make sure we take care of our employees, that they're not burning their days, that if they are quarantined or they do have COVID, that they meet the needs of that leave. That's a great question. Thank you.
Is there a maximum time on that contagious disease leave? Okay, because it was limited to 14, I believe, last year.
That was the state leave.
The state leave was limited to 14. Okay. All right.
It takes a full team to have all the, with COVID, you got so much going on, and there's so many times, I mean, it's like, okay, Jennifer and I talk a lot. What do you think? And then let's call the health department, see what they think. And there's so many impromptu phone calls and conversations of making sure, we want to make sure we take care of our employees, take care of our students, and get it right. Because sometimes the guidance does change. Sometimes you encounter situations through dealing with this for 18 months. You think you've encountered every situation, and then next thing you know, you have a situation that you've not dealt with. And so to be able to make sure we do the right thing.
Dr. Fisher wants to may I?
Yes.
That's one more question. This may be a Tiffany question, but I'll ask you.
Oh, it may be. I think it is a Tiffany question already. I can already tell.
At the end of last year, I'm recalling, I haven't looked this up, but that the social distancing or our distances had dropped to 1 meter, which was the WHO's recommendations from the beginning. Has somebody stretched that back out to 6 feet, or are we still at 3.2 feet?
It is at 6 feet. If one of the parties is non-masked, then it is 6 feet. Yes, sir.
Okay.
That's right. Tiffany,
Ms. Hampton?
you're all set.
Mr. Chairman, fellow board members, thank you. And Mr. Humphreys, just to kind of expand on that 3 feet versus 6 feet, Dr. Fisher is correct. So the CDC guidance still defines direct contact as 6 feet for 15 minutes. With the Strong Schools Toolkit, you'll see that there's a little bit of relaxation now between 3 and 6 feet. It still doesn't necessarily make them not a contact, but it does allow the schools a little bit more flexibility on how close to place children.
Okay.
Okay. So really kind of my presentation tonight is really focused on data and metrics and some of the questions that you all had at your last meeting, and really kind of where are we in Cleveland County. And so the first slide, if you're following kind of NCDHHS, the COVID dashboard, this is an image that you'll likely see on there. We have 12,708 total cases in the county. Recovered 12,047, so about 95% of all of our cases have recovered. Our estimated active cases, so these are the ones that have occurred in the last 7 days. These are the most likely to be under quarantine or isolation restrictions. There's about 430 of those in the county. And if you've been kind of following our data, you'll see about 4 weeks ago, this number was about 100. And so we're definitely experiencing some uptick. On the right side of that graph, you'll see that those lines obviously are increasing. Total deaths, unfortunately, we're at 231. Residents hospitalized, I actually got an update shortly before I arrived here. We actually have 25 residents that are currently in the hospital. Percent positive confirmed laboratory tests for Cleveland County, we're at 16.6% today. In North Carolina was at 11.1%. This graph, I really like it. This breaks down all the ages across kind of the entire pandemic on lab tests. And Dr. Fisher, they have copies of this? Yes, okay. And so you'll be able to see really the colors outline what ages are impacted and when they're impacted. And I'll draw your attention to kind of that red circle. And you'll see over the last 4 weeks, we've seen a trajectory of increased cases. What I will also draw your attention to is some of the age groups that are being impacted. So on here you can tell mostly impacts are seen in our 25 to 49-year-old age range, although we are seeing some slight increases in the 0 to 17, recognizing that 0 to 12 cannot get vaccinated. This image is another one that's also displayed on the NCDHHS COVID dashboard. This also breaks down ages, but what this does is really give you a percentage of the total cases that we've experienced in those age brackets. And so 0 to 17, we've had about 1,500 cases, so about 13% of all of our total cases in the county. 18 to 24, 12%. 25 to 49, about 35% of cases, which is similar to kind of the trajectory that we've seen along the course of the pandemic. 50 to 64, about 23% of our total cases. Our 65 to 74-year-olds account for about 10%, and then 75 and above is 8% of our cases. And then you'll also see on the right-hand side, really just breaking down to individually how many cases fall into those age groups. One of the things that the CDC, NCDHHS reference is kind of community level of transmission and where you should be at according to your community's level of transmission. We just transitioned, actually today, NCDHHS updated this, and so this is a direct link to the CDC. This is kind of the community transmission map, and that's how they determine low, moderate, high risk, or substantial and high risk levels of transmission, based really on total of new cases per 100,000 residents, and then percent positive diagnostics. And then as you can see from that image of North Carolina, most of the entire state is in red. What's likely leading and contributing to many of those red counties in our transmission levels, as you've heard tonight, is this Delta variant. So the graph there on the left really depicts Region 4 of Health and Human Services, which North Carolina falls into. And in that kind of orangish bar, you'll see that is the Delta variant. And if you follow that along, really over the last 4 to 6 weeks, we've seen that start very small in the 2 to 3% of all sequenced lab tests being done, to right now where we were the middle of, or the end of July, was about 80 to 95% of all sequenced cases in North Carolina really are the Delta variant. And so from kind of the state epidemiologists and what they're kind of saying from the state level is, if people are getting sick in our communities and we're seeing that, it's most likely Delta variant just because of the level of sequencing that's being conducted. One of the things that research is also telling us related to Delta is that it has a little bit higher transmission rate than the regular strain. And so we've heard anywhere from about 2.5 to 3.5 times the level of transmission Delta has versus the original COVID strain. So for every 1 positive, instead of 2, we're now getting around 5 or 6 of people that could be impacted by that. The next slide really depicts our vaccination rates. So the leading preventative strategy for impacting the Delta variant as well as the COVID-19 pandemic is vaccination. So this really outlines age breakdown on vaccination in the county as a percentage of the total population. And so as you can see, our older population, 65 and above, they are highly vaccinated for the total amount of the population that they contribute or that they make up in the county. One of the things that was also added to the dashboard today was this ability to break down 12 plus vaccination, 18 plus vaccinated, 65 plus. So you can kind of see some of the different variations depending on the age categories. So 12 plus year old vaccinations in the county were at 46% for a single dose, 42% fully vaccinated. For all individuals 18 and over, we're about 49% with single dose and about 45% for fully vaccinated. So I think that we're making strides as a leading preventative strategy and one that we're very much promoting at the health department as well. One thing that comes with our vaccinations is also breakthrough cases, and I know someone had made a few questions at your last meeting about the numbers of potential breakthrough cases that we had in the county. This is data collected from the state for breakthrough cases, which are really anyone who would test positive for COVID-19 after they've completed the vaccination series. And so I kind of circled around there the 0 to 17, recognizing that 0 to 12 can't be vaccinated. So this is really our 12 to 17-year-olds that are fully vaccinated. So they've either completed 2 doses in a 2-dose series or 1 dose in a single series. And this is Region 7, which at the top, you'll see really outlines a number of the counties, Alexander, Catawba, Iredell, Rowan, Cleveland, Gaston, Mecklenburg, Union, Cabarrus, Stanley, and Anson counties. And we've had 28 individuals in that 12 to 17 category that the CDC classifies as a breakthrough case, meaning that they got fully vaccinated and then beyond that 14-day window of vaccination, they actually tested positive again. And then the last slide I'll leave you with, and I know that you guys have seen all of these strategies, but CDC, NCDHHS, American Academy of Pediatrics, Dr. Fisher has mentioned it, Strong Schools Toolkit, really is this notion of layered preventative strategies. It's the most effective at really lowering our risk of transmission. COVID-19 vaccination, encouraging those that want to get vaccinated, proper and consistent use of face coverings, physical distancing when we can, ventilation strategies, if there are some that are able to be explored, taking advantage of that, incorporating good hand hygiene practices, good respiratory etiquette, especially as we lead into flu season, that's very important. Testing availability, so really just encouraging folks to get tested if they are symptomatic or screen if that's an option. Symptom monitoring, don't come to work if you're sick, don't send your child to school if they're sick, and then really just strong disinfection practices. All of these kind of coupled on one another or a combination of them really help us lower the risk of transmission. That's all I have. Any questions for me?
Any questions from the board?
I have one. How many deaths in Cleveland County from 0 to 12 have we had?
Mr. Shores, there is 0 deaths from 0 to 12 in Cleveland County.
How many hospitalizations from 0 to 12?
Yeah, that one's a little bit more challenging. I actually reached out to the state to see if we could get comprehensive hospitalizations on 0 to 12, and they weren't able to get us 0 to 12 on hospitalizations. They did send me national data, and for 0 to 12, we've had just 2% that have been hospitalized, and that's national.
Okay. Thank you.
I'm kind of curious on the chart with is the Region 4 variant proportions?
Oh, I know, I can't go back.
What's
Yes.
the difference between a VOC and a VOI?
VOC, variant of concern and variant of interest. So that the CDC classifies the different variants. So if you look at that other chart where it had the kind of bar graph with the variant levels, there are variants of interest and variants of concerns. And the CDC classifies those based on transmission, how likely they are to develop severe illness, all sorts of kind of different metrics go into establishing them as a VOC or a VOI.
Because it looks like there's 3 more variants listed beyond Delta, and the IOTA
Right.
has, I guess, several different subclasses. Is
Yes.
that? Okay. So
Yes.
there's a lot more out there besides Delta.
Right, and there are likely, I would share kind of as a tidbit of information for that, there are likely many other variants that are to come. This is a virus, and so many times it does mutate just by nature of their composition. The state virologist had shared with me just the level of mRNA or RNA, the DNA sequencing that makes up this virus is very long, and so as it replicates, it makes mistakes.
But those are the variants that have been identified so
Right.
far. Okay.
Lambda's not in the United States yet.
Not yet. Mr. Blanton.
What about 12 to 20? I'm telling on Joel's, Mr. Shores' thing of cases on death of the COVID in Cleveland County.
Of 12 to 20?
Yeah, 24.
I didn't even get those numbers for you, Mr. Blanton, but I can surely follow up with that one, because I did not gather that one for you tonight.
Because, we got children that's 18, 19 years old in school.
Right.
And that was the reason I would go from there.
One other question. Would you agree as a medical professional that this virus has a host and will be around forever?
I think a virus by nature, yes.
No, but non-human host, right?
No, but it could have an animal host, it could have some other kind of host.
Right, right, that's how viruses continue to
It's the
replicate.
flu,
Yep,
the
mhm,
flu
the flu
that's
is a
been around
virus,
forever.
yes,
And I'll get to
yes.
that point a little later.
Yes, as long as it has a cell to inhabit, it will continue to replicate, yes.
Ms. Hanson, quick question here on the breakthrough cases. You're saying that's through Region 7, and that's multiple counties within Region 7. What's that?
Correct.
All right, and so 28 out of ages 0 to 17 in Region 7 have had breakthrough cases.
Correct, yes.
So if you look at cases of fully vaccinated in Cleveland County of 12 and up, it's 35,666. Is that per?
In Cleveland County?
In
Or
the
according to the region?
vaccination rates in Cleveland County?
Right, right,
At
that's the
42%.
vaccination rates,
All right,
yes.
so that number out of just Cleveland County is 0.00078%.
If you applied the 28 to.
To the
Cleveland County.
number in Cleveland County. So that number of breakthrough cases in Cleveland County is actually going to be less than that.
Correct.
Okay, thank you.
One quick question. Me and every other board member and everybody in this building have had discussion about COVID, especially knowing that there would probably be an update at our meeting. And I've heard today that Cleveland County ranks in the top 3 or 5 with the high percentage in the state and they never see it, but that's what I hear. So is that true?
And so that's probably referencing number of cases per 100,000 and our percent positivity, which is used to kind of determine that transmission level mapping. And I haven't seen today how high we are on the chart, but I know last week when I got an update, we are definitely trending in the top 10 of the state as far as transmission rates based on those two figures, yes.
And on strategies to prevent that, the top 2 on the list here is receiving the vaccine. And the next one is proper and consistent use of face covers. Is that correct?
That is correct, yes.
All right.
Any other questions for Ms. Hanson? All right, thank you.
Thank you.
Are we going to continue to have some conversation?
We can.
I
If there's any
definitely,
questions for Dr. Fisher, or we can have further discussion.
yeah, before we move on, I would definitely like to have some more conversation. You know, when we met last, I feel like we met like a day or two too early. So a lot changed over that time from that meeting that we had that evening to where we're at right now. I don't know, I know all the board members received an email. I don't know if the public realizes it, but we received a email from the Shelby Children's Clinic here in Cleveland County. And basically in their email, I'll be happy to share it with anybody. Their recommendation is for us to change the policy for mandatory masks for our students and staff. These are individuals that we trust. These are individuals that we, majority of our citizens have trusted to take care of our young people. And we're school board members. We always look for guidance. If we're going to do a project, building a add-on to a school, we go to the experts. We get the engineers. We get them to do all the stuff. This is a time that we need to listen to the experts. I look at the Shelby Children's Clinic as the experts in this. As Ms. Hanson said, looking at the PowerPoint, 2 of the top to make sure that we can hopefully get the numbers down is vaccinated and proper and consistent use of face coverings. My goal, and I feel like everybody else's goal here with the school board, is that we want our kids in school. And if we don't do something, we are going to be sending classroom after classroom home, and they are not going to be in our classrooms and in our schools where they need to be at. It's concerning to me. Over the last 2 weeks, I've had a number of teenagers that I have spoken to, and it's constantly that I hear that they went on mission trips, outings with other teenagers, church gatherings, going on trips, and they're consistently telling me the number of students that have come back positive with the virus or they're all quarantined. And that's just our churches and youth groups going off. Once we get them into the building, if we don't have masks, our numbers of students and staff to be quarantined will rise. And I understand when people say it's your right. I mean, I voted last time that we make it optional. But a lot of things have changed. Back in 1985, I refer a lot of stuff back to my career of when I was with the Highway Patrol. But back in 1985, a lot of y'all might remember they passed the seatbelt law. And I've had to deal with that throughout my whole career because I got into law enforcement in '86 and I've heard it. You know, it is our right whether we can wear a seatbelt or not. Nobody needs to tell us that we need to wear a seatbelt. All right? I've heard that and I heard that. Well, they passed the law that they had to wear a seatbelt to protect that person wearing a seatbelt. Testing and surveys and crash stuff, and it kept on. After a time, they decided to make everybody in the car to wear a seatbelt. And the reason I tell you that, why did they make everybody wear a seatbelt? Why can, if I wear the seatbelt and Mr. Hunt don't wear a seatbelt, what does it matter? It matters a lot. I'm protected in that seatbelt, but if I'm involved in a crash, I'm not protected from him. Because if I'm involved in a crash, the number one injury that you get is the other passenger in the vehicle hitting somebody in the car, head to head. So it's not that I'm just protecting myself with the seatbelt. With Mr. Hunt wearing his seatbelt, he is actually being protected. I'm being protected so he won't come over and injure me. And that's the way I look at it. We've got to protect our kids. You know, there's a lot of people that will probably wear their masks, but we've got to keep our kids, we've got to keep our students in the classroom. It is so important that they're there. It is frustrating for teachers and students to wear a mask. I'm the first one to say, I don't like wearing a mask, but I'm not wearing one tonight, but I'm going to have to start back. I've always wore it on a regular basis, but we've got to do something to get these numbers down. It is not good. It's nothing to brag about to be in the top 10 in the state that have the highest percentage of COVID. That is nothing to brag about. And we as a school board, like what Ms. Steele said, one of our goals is to have healthy environment for our students, a safe, healthy environment. And then we've got to be able to do that. And I support that we change it to make it mandatory masks for our students and staff that are on our property.
No.
Mr. Chairman, are we going around or?
Just to lay some ground rules, I know everybody wants to speak. We want to give everybody a chance to say what they need to say, and we'll hit everyone that wants to talk, and then if we need to do a second round, we can discuss that then. So, Mr. Humphries.
Okay, thank you. Thank you, Mr. Chairman. I'm not going to argue about science on this because you can go out and you can find dueling PhDs in epidemiology and virology all over the place. Somebody could teach me to fly the space shuttle easier than they can explain all this virus stuff to me. So I'm going to take a different approach on this. We're going to go to civics class. Mr. Glover just very aptly pointed out, and I'm coming from DOT, I totally get the seatbelt, but they passed a law. That's the key phrase. The legislator passed a law. So Mr. Glover operated under an enabling act for the Highway Patrol. I operated under an enabling act for the Department of Transportation. We operate under an enabling act for the public schools in North Carolina. There's 1,000 pages in this thing. I haven't read every word in it. True confession, haven't read a bunch of them, not all of them. So, that being said, we have to operate within this set of laws. North Carolina General Statute 136 and 47, and contained in this, explicitly addresses the powers and duties of school boards. Most importantly, ensuring that all students receive a sound basic education. We're in the education business. Articles within this legislation clearly define the school's role versus parental rights and authority, most notably in medical and healthcare issues. Schools are not authorized to provide or administer any medications or medical devices without a parent or legal guardian's written consent. We cannot legally give a student a cough drop or a Tylenol without parental consent. The only exception to this is in case of emergency health care. Per the U.S. Food and Drug Administration's webpage, the FDA regulates face masks, including cloth face coverings, and surgical masks as medical devices when they are marketed for medical purposes. Medical purposes include, and I'm still quoting, include uses related to COVID-19, such as face masks to help stop the spread of disease. We have never been in the business of administering medications or medical devices to students without parental consent, and we should not start now. In my opinion, it's not our place to tell students to wear a face mask or not. That's the parent's decision to make. And like I said the last meeting, I trust our parents to make an informed decision. Thank you.
I'm going on Mr. Humphries. It should be a parent's decision. I'm not telling, as I said before, I took the shot. And if anybody wants to take the shot, that's their business. If they don't want to take it, that's their business. It's their life. It's not mine. But we do not have the right to tell someone that they have to do this. Are we going communism? I've just said point blank. Is that what we're doing? I'm saying it should be a person's choice. Mostly of the parents on the underage and our teachers. It's tough for them to teach up there with that mask and understand. Because when we've got our mask on, I can't understand anything of what anybody's saying hardly with my hearing. There's a lady spoke to us tonight. She give us down the road about masks. Well, she didn't have one on. She should have had one on if she was going to get on us like she did. But I can take it. She can get on me all she wants to. It's a person's choice. Thank you.
Thank you.
Anyone else? Mr. Taylor?
Thank you, Mr. Queen. I want to clarify and make a little correction. Yes, in our last board meeting, I did say I did have the COVID vaccine. But I'm pretty sure I went along to that and said that personal choice was my choice to get it. It's also my wife's choice, my daughter's choice, and my son's choice. When I had COVID, I spent 7 days at home. Wife, both kids, free to go about their business, didn't have to quarantine. So I say that to say it is personal choice. If you want the vaccine, go get it. If you don't go get it. But when it comes to you sending your kids to Cleveland County schools and you want us to make a sound decision for best education, if they're not in school, they're not getting education. If they're not if they're not able to get the quarantine, they're not able to get the vaccination, and they're not able to if they're not wearing a mask, then they're going home. And if they can't get on, if there's students that can't get on internet, that can't get to be able to get the education they need, then what are we doing? What are we doing it for? Yeah, it is your choice, and it's not my choice to say why you don't do it, but my choice is to, the way I feel is the children that aren't able or don't have the option to take the vaccine should have to come in mask. Now, if the kids are able to come grades 9 through 12, they have that option, they choose to take it, then I think we give them the option. But that's and to touch on, I got email after email after email. We sit here and listen to everybody talk that it's politicized. I said it before, and I'm gonna say it again. I'm not voting for the R, I'm not voting for the D. I'm voting for exactly how my conscience tells me to vote. And if anybody's upset with that, sorry.
Thank you, Mr. Taylor. Ms. Green?
Okay. I just want to say that I'm not pushing a vaccine on anybody. I do believe that vaccine is a personal choice. Myself, along with all the other school board members, we got several email after email after email. You know, some of them were stating things such as studies out of states that does not apply to us. And I know we're looking at overall, but when we have our local people here, our local health department, our local children's clinic telling us things that are facts. Some have said it's common sense. I think common sense is listening to the experts. No, I don't personally like masks myself, but if it's gonna help protect others around me, I'm gonna wear it. You say that we're in the business to educate kids, and that's what we are here to do. But it's gonna be hard to educate our kids when they're not at school because they're quarantined at home. And even if a kid is vaccinated and they've done everything they can, they have a mask on trying to protect themselves, if they're within 6 feet to an unvaccinated kid that tests positive, they have done everything that they can to protect themselves, but they still have to go home and quarantine. And so I just think we can educate our kids better if they're in school. And there's a lot of concerned parents, and we've gotten some emails about, well, masks are dirty if you see what's on their mask. And I don't mean no harm, but they sell disposable masks that you can wear and throw away. Or you wouldn't let your child wear a pair of socks for 7 days a week without washing them, correct? So why let them wear a mask 7 days a week without washing it? So that excuse right there is just, you know, kind of, and I don't know the word to say that's proper. But like I said, I just wish, especially the kids that cannot make a choice to get vaccinated, a lot of parents want their kids vaccinated that are under 12 and they can't get them. So I just think that we should do everything that we can do to protect it. And it's not one thing. The vaccination is not going to protect everybody. The mask isn't going to protect everybody. But when you start doing different things layering, I mean, we had very good results last semester in the spring. And I think we could come back and have those same results. I just don't want to see a lot of kids out because they're quarantining. I don't want to see sports canceled. I don't want to see things moving into the future, senior projects canceled, graduation. I just want us to be able to go to school, educate our kids, and do what we have to do, whether we like it or not. It won't be forever, but let's just do what we can to keep our kids safe.
Thank you, Ms. Green. Mr. Hunt.
I think if we take the politics out of this debate, we can use rational decisions and come up with decisions that's best for our students and our staff. We know that the Delta variant is here and it's real. We've listened to people from our health department give you the statistics, and we can't deny that they're not real because this is someone that's out there monitoring that. If she hadn't come to this board meeting and to let me know what those statistics are, you know, I wouldn't know what they are right now, and you wouldn't either. But she came and she gave us a presentation, and I don't think she made them up. You say we're not here to tell parents what to do, to infringe upon their rights. But we vote on policies and procedural things that must happen in the school. We voted on them tonight. We vote on something every board meeting that basically dictates how schools are ran. So we need to come off of the notion that we're not telling people what to do. You know, people put us here for a reason, and that's to use common sense. The Delta variant, COVID-19, is more rampant in the younger generation now than when COVID started 18 months ago. We listened to the experts then when we had to make a decision to close schools. We thought we were going to close schools and be back in a couple of weeks. That did not happen. We're still dealing with it today. I just want us to err on the side of caution. I don't like the mask no more than anyone in this room. I hate them, but I wear them. I'm saying with COVID happening the way it is right now, on the increase, we cannot ignore the fact that we've got to put some things in place to protect our children and the adults that's in the schools with those children every day. Because if we don't, we've seen other counties that started back to school, and we've heard on the news what's happening with COVID. It's spreading. And if we don't take the politics out of this and use common sense, it's going to spread here in Cleveland County.
Mr. Fitch or Mr. Shores?
Well, I've took a lot of phone calls just like everybody else has. Most of the calls I get are my kid can't learn because they're in that mask. They can't breathe. They have allergies. They're claustrophobic. It's a horrible situation at home. But I made a comment last week, and I want to go up and clarify it, that I didn't quote something that I talked about. So let me, before I got done with the last meeting, the article was on my phone. Someone had texted it to me, but I looked at that one, and I looked at a number of other news articles, and many of them ran this story, and shame on them if it's false, but I will quote the Alacuna Chronicle, June 12th, 2021. A group of local parents sent 6 face masks to the lab at University of Florida requesting an analysis of contaminants found on the masks they had worn. The resulting report found that 5 masks were contaminated with bacteria, parasites, fungi, including 3 with dangerous pathogens and pneumonia-causing bacteria. The analyst detected the following 11, and I'll not read them all because to be honest with you, I can't pronounce some of these long words, but I can understand pneumonia. I can understand tuberculosis. I can understand meningitis. I can understand food poisoning. I can understand Lyme disease. And these were washed before the kids put them on and wore them to school. While I was there, an interesting article came up on PubMed.gov, a government website, where a bunch of doctors did a study on surgeons wearing masks. And without reading that entire report, I'll read you the conclusion. The source of the bacterial contamination in surgical masks was the surface of the surgeons rather than the operating environment. Moreover, we recommend that surgeons should change their masks after each operation, especially those beyond 2 hours. Double-layered surgical masks or those with excellent filtration functions may be also a better alternative. So this was basically telling those surgeons that after 2 hours, your mask is dirty, and we're asking a kid to wear it for 5 to 6 hours a day. I can't do that. Former President Biden COVID advisor and top epidemiologist Michael Osterholm stated, and I quote, "We know today that many of the face cloth coverings that people wear are not effective in reducing the virus movement in or out." Osterholm, the director of Center for Infectious Disease Research and Policy at the University of Minnesota. Then I decided I was going to go to the CDC and look up some numbers there. Since January of 2000, which was the beginning of COVID, to July of 2021, which is 16 months, it listed from the ages of 1 to 4, 41 deaths, and from 5 to 14, 119 deaths as relate to COVID. That's why I specifically asked that lady how many deaths in Cleveland County of children 0 to 12. She said 0. I asked her about hospitalization, she couldn't tell me an answer. Then I went on and looked from 0 to 4 who had the flu in 2018 and 19 was 266 with 25,328 hospitalizations. Age 5 to 17, 211 with 21,012 hospitalizations. In 2019 and 2020, age 0 to 4, 254 had died. So let me go back and say that. 0 to 4, 266 children died of the flu. 5 to 17, 211 died of the flu. Age 0 to 4, 254 in 2019-20 died of the flu. Age 5 to 17, 180 died of the flu. That's double the amount of kids that died from COVID. I wonder what in the world would happen if we put all these statistics together and have presentations on the flu, which we've never masked kids for. I have had someone send me a video that I think can explain something a little bit better than I can. If you'd play that video.
And we're getting our sources of information from the State Board of Health and the CDC, who actually don't bother to read science before they do this. I'm actually a functional family medicine physician. That means I am specially trained in immunology and inflammation regulation. And everything being recommended by the CDC and State Board of Health is actually contrary to all the rules of science. So things you should know about coronavirus and all other respiratory viruses, they are spread by aerosol particles, which are small enough to go through every mask. By the way, the literature that supports all of that is in the flash drive that we presented to you as the Secretary. As a matter of fact, it quotes at least 3 studies sponsored by the NIH to that exact fact, even though the CDC and the NIH have chosen to ignore the very science that they paid to have done. That is why you keep struggling with this, is because you cannot make these viruses go away. The natural history of all respiratory viruses is that they circulate all year long, waiting for the immune system to get sick through the winter or become deranged, as has happened recently with these vaccines, and then they cause symptomatic disease. Because they cannot be filtered out, and they have animal reservoirs, and this is a very important point, no one can make this virus go away. The CDC has managed to convince everybody that we can handle this like we did smallpox, where we could make a virus go away. Smallpox had no animal reservoirs. The only thing it learned to infect was humans. That's why we were able to make that virus go away. That will not happen with this any more than it will with influenza, the common cold, respiratory syncytial virus, had no viral respiratory syndromes or anything else that has animal reservoirs. So the reason you can't do this is because you're trying to do something which has already been tried and can't be done. Equally important is that vaccination changes none of this, especially with this vaccine. I would hope this board would start asking itself, before it considers taking the advice of the CDC, the NIH, and the State Board of Health, why we are doing things about this that we didn't do for the common cold, influenza, or respiratory syncytial virus. And then ask yourself, why is a vaccine that is supposedly so effective having a breakout in the middle of the summer when respiratory viral syndromes don't do that? And to help you understand that, you need to know the condition is called antibody-mediated viral enhancement. That is a condition done when vaccines work wrong, as they did in every coronavirus study done in animals on coronaviruses after the SARS outbreak, and done in respiratory syncytial virus, where a vaccine used in a vulnerable individual, done the wrong way, which cannot be done right for a respiratory virus, which has a very low pathogenicity rate, causes the immune system to actually fight the virus wrong and let the virus become worse than it would with native infection. And that is why you're seeing an outbreak right now. In fact, in that flash drive they're going to have coming to you and in the emails, the 6 extra will be a study showing that 75% of people who had COVID-19 positive symptom cases in Barnstable, and Massachusetts outbreak were fully vaccinated. Therefore, there is no reason for treating any person vaccinated any differently than any person unvaccinated. You should also know that no vaccine, even the ones I support and would give to myself and my children, ever stops infection. In 2014, there was outbreak of mumps in the National Hockey League. The only people who came down with symptoms were the people who were unvaccinated or unknown vaccine status. Boy, that sounds like a great argument for vaccines. But a question you should ask yourself, knowing that half of the people who came down with symptomatic disease had no contact with an unvaccinated or unknown vaccine status individual, where did they get the disease? And the answer was from the vaccinated individuals. No vaccine prevents you from getting infection. You get infected, you shed pathogen. This is especially true of viral respiratory pathogens. You just don't get symptomatic from it. So you cannot stop spread. You cannot make these numbers that you planned on get better by doing anything that they're doing. Because that is the nature of viral respiratory pathogens. And you can't prevent it with a vaccine because they don't do the very thing you're wanting them to do. And you will be chasing this the remainder of your life until you recognize that the Center for Disease Control and the United States Board of Health are giving you very bad scientific guidance. And instead, read the articles that are going to come on the email or on this flash drive and listen to the people in this audience here tonight who actually recognize the advice they are getting from the CDC and the NIH is counterfactual. And that's why you're still fighting this with this vaccine that supposedly was going to make all this go away, but suddenly managed to make an outbreak of COVID-19 develop in the middle of the summer when vitamin D levels are at their highest. By the way, the other thing that would necessary any vaccine restriction to be considered is if there were no other treatments available. And I can tell you, having treated over 15 COVID-19 patients, that between active loading with vitamin D, ivermectin, and zinc, that there is not a single person who has come anywhere near the hospital. And we already have studies that show that if you treat with 25 hydroxyvitamin D level greater than 55, your risk of COVID-19 death will drop down to 1/4 of the population average for the United States. And there are active treatment trials included on that flash drive that show the same is true. So if you're going to discriminate based upon vaccine, you should also discriminate based upon 25 hydroxyvitamin D level, zinc taste test response, and probably previous infection, since there are also studies on that flash drive that show that people who have recovered from COVID-19 infection actually get no benefit from vaccination at all, no reduction in symptoms, no reduction in hospitalization, and suffer 2 to 4 times the rate of side effects if they are subsequently vaccinated. Therefore, the policies that you are basing on are totally counterfactual. I don't blame this board for that, because I know you aren't scientists and you thought it was reasonable to listen to the CDC, NIH, and the Indiana State Board of Health. But I would encourage that instead you listen to the people out here in this audience and read what's on that data drive. And if anybody here in this board has any questions about anything on that, I will happily come back and sit with you individually if you would like to explain the science behind this. And if you're worried about being sued by somebody because you don't follow the guidance of the CDC and the NIH, I will tell you have a free pro bono expert testimony at your disposal. I will testify in defense of this court, turning down all these recommendations for free at any time, at any court. Thank you.
Thank you.
And I'd like to, if this board moves to mandate masks, we know we're going to have a medical exception. I am not going to expose kids with medical conditions. That's what we're going to do when we mandate. We're going to have a medical exception. And one kid sitting in an elementary class without a mask and ask the teacher, why do they not have on a mask? What's the teacher going to say? Are we willing, there's enough bullying going on in school. Are we willing to let people with medical conditions get bullied, get picked on, or whatever, because they're not wearing a mask. And folks, if you don't realize it, there is bullying going on in school. And some of these people with these medical conditions already have enough problems. They don't need to be set there and singled out because they're not wearing a mask because of medical conditions. Thank you.
I think you're the only one that hasn't spoken.
Yeah, I'll just say a few quick words. Not much I have to say after that video, other than I believe it ought to be the choice of the parents, whether the kids wear a mask or not. I have also received many emails from teachers who are asking for us to not pass a mandated mask. Where this is coming from teachers here in the Cleveland County School System. They say they can't effectively teach with kids in masks. The concentration rate goes down. They can't concentrate. They have severe headaches, dizziness. They can't breathe. So therefore, they do not pay attention in the class. So I think we need to listen to the teachers of this school system as well. And we need to leave that an option for the students and teachers and parents.
Well, I'm the only one that hasn't spoken. I'm not going to add anything because there's been plenty said. I will point out, Dr. Fisher has gone through our COVID protocols. As it stands, masking is optional in the classroom. It is mandatory on buses for students and drivers because of the federal mandate. So, and that's the way it'll stand in absence of a motion differing from that.
Can I ask a question of Dr. Fisher?
Yes.
Dr. Fisher, you forwarded us an email, and it's always good to see if that information is accurate. I just want to make sure it's correct. But this email that came from a school health supervisor, is saying that if all students are masked by all, contact tracing is very limited. That contact tracing is limited, mostly lunch and other activities as sports. Is that correct?
Yes, sir. That's my understanding. That's correct. And I think that if everyone is wearing a mask, then you do not have contact tracing. And so I think the point of the email, not to add words to the email, was that if you have people without masks, that you have contact tracing because you have the potential for spread. So even if you had everybody with a mask, you would still have contact tracing during lunch, during athletics. There were times where somebody would not be masked. So if you remember going back to my slides, where the contact tracing was, it was 6 feet for more than 15 minutes in a 24-hour period if either party is unmasked. So even if you had a classroom where, not everybody in the classroom was masked, but if you had the people that were 6 feet away from a student and that student was masked and everybody was around 6 feet was masked, then you wouldn't have quarantines. But if any of those were unmasked, then you would have quarantines.
And also throughout the email, it said a 14-day quarantine would be potentially a 60-hour instructional hours are lost for that particular student. Is that
when we equate instructional hours, we look at 6 instructional hours per day. That's why we go in our instructional day from an instructional hour perspective, whether that's elementary, middle, or high school. So for a day is really 6 instructional hours. That's taking out lunch, taking out recess.
Okay. And I respect everybody's opinion, and I really enjoy hearing discussion. I want to say it's discussion. I think it's healthy for this board to sit around and to have discussion. I think it's healthy to hear from the individuals that came and spoke this evening. But we're your school board members. I'm not a doctor in no means. But when I have the experts, I call them, I wish I could talk to the health director, but she's already gone. But when the number 2 thing is properly and consistent use of face coverings, that tells me, man, if we're going to beat this thing, if we're going to keep our kids in school, we might not beat it, but if we can keep our students in school, we need to wear face coverings. When we have 16 doctors to send us an email, and they're giving us the recommendation that our students need to be masked. These are trusted healthcare professionals. And then we have another doctor to come and speak and tell us his recommendation that we need to have our students and staff masked. I mean, I don't know what else the public can do to tell this board for us to do that. In saying that, I'd like to entertain a motion that we make masks mandatory for our pre-K through 12 schools for students and staff and teachers.
I need to ask. Well, hold on just a second. Did you have that written out?
I did not. I do not write any of my motions out because I want to hear discussion, because I'm not sure what I'm going to vote until I get here. So I don't write my motions out.
Please say that again.
I make it Cleveland County Schools mask mandated for pre-K through 12th grade in our schools for students, teachers, and staff.
And I'll second that.
Okay. Motion by Mr. Glover and second by Mr. Hunt for a mandatory mask pre-K to 12 for students, teachers, and staff. All right, any discussion on that? Yes, sir.
Well, it's not on that motion now, but I've got one thing I'd like to say.
Well,
How are we going to play Friday night football with 8+ teams, 50 or more players on each one of those teams, if they got to wear a mask? Okay. Okay, all right.
All right, any discussion or questions about the motion?
According to the motion, as I understand it, those with medical conditions, we are mandating have to wear a mask. So I
I've
think,
always had that exemption.
I didn't hear it in the motion. The motion was to mandate it for everybody K through 12. Everybody's everybody.
Amend that, put that in there.
Mr. Chairman, if I may.
Yeah. Mr. Policy, is there anything in our current policies that allow for a medical exemption?
Oh, absolutely, yeah. In fact, our policies require parental consent for any medical device by following the general statutes. And that's kind of where I've got the problem here. We're
breaking the law.
So last spring, masks were mandated. They weren't mandated by a school board. They were mandated by the governor of the state of North Carolina. Back to civics class. We'll leave the federal government out of it because they don't have any authority over school systems anyway. But you have the governor, and down here is us, the school board. We're just above the water board. We're just about the lowest ranked elected officials in the state of North Carolina as far as authority goes. Our authority is very limited. It's here. It's very clear. We don't have medical authority over parental consent. So how we can sit here and pretend to mandate something when we don't have the legislative authority to do it is beyond me. And we should not have the legislative authority to do it. The governor, absolutely, he's the governor of the state. He can mandate things with executive orders. That's the way the law works. So we want to talk about this being politicized. Hey, let's go there. What's up with the governor? If masks are so important and it's so vital, why does the governor of the state of North Carolina saying, oh, no, watch his body language when the reporters ask him about that. Oh, no, we're vaccinating. He don't want to go there because there's a midterm election coming up. That's political. That's politicalization right there. Look, we're the school board. We're concerned about schools. Look at all of our policies. Read through the general statutes. We're supposed to be focused on education. There's a Department of Health and Human Services. There's all kinds of layers that deal with health concerns. And I'm good.
Okay. Any other discussion on the motion? Sir, we don't recognize folks from the audience. I'm sorry. We had public participation earlier. I've seen your hand up, but we just don't have time for that. Any other questions or discussion on the motion? Ms. Sink, I hate to put you on the spot, and I usually don't ask a question that I don't already know the answer to, but in lieu of Mr. Humphrey's analysis as far as legal authority of the school board, is the motion in order as far as mandating masks?
Because there's an executive order from July 29th that essentially pushes us to the toolkit, and the toolkit leaves it in our discretion to use the word should. We have the discretion as a school board to choose to have mask optional or to mandate mask. Of course, there would be medical exceptions. That's part of the toolkit guidance. So because while there's an absence of legislative authority, we do have the executive order, which does have the force of law. The executive order essentially pushes that to the toolkit, and so that's what our guidance is. So we do have the discretion to make that choice.
Okay.
We won't be breaking the law either way we vote.
Thank you.
The earlier comments by Mr. Humphreys about the history of us not directing medical decisions and without parental consent, I would say is still very accurate. But the specific decision about mandating versus not mandating, we do have that discretion.
And that's because of the executive order?
Because of the executive order from July 29th, yes, sir.
Okay. Yes.
I'm not going to argue with somebody that does this for a living, but I will anyway. I'm not going to argue with you. Just a quick question. I mean, so the executive order says should.
Yes.
The recommendation in the toolkit says should. So two shoulds don't make a must, right?
Well, we have that option. The
So-
executive order is not telling us that we have to.
We have to or don't have to, I get that, but I can't help but wonder if we're not trying to operate under color of law instead of direct force of law.
I understand where you're coming from, and I think that if, the word should could eventually be litigated, I think that the general understanding of that executive order, then pushing it to the toolkit, it does give us that discretion, in my legal opinion. But I do understand that there could have maybe been a stronger word used to make it more clear. I know where you're coming from.
So would you agree that if this was a huge concern to the governor of North Carolina, he has the absolute authority to say must, and then it's mandated?
I would agree with that statement, yes, sir.
Any other questions for Ms. Sink? Any other discussion on the motion? I think we're done with you. All right. The motion on the floor is to make mask mandatory for pre-K to 12 grades for students, teachers, and staff. It's been moved and seconded and discussed. Last chance for discussion. Going once, going twice. All right, those in favor of the motion as presented, if you'd raise your hand. Any opposed? Motion fails 4-5. Folks, we still got business to conduct. Mr. Blanton, did you have any further question for Dr. Fisher?
Well, yes, I just wanted to ask that question. If that had a passed, what was we going to do about those 11 football players Friday night?
Let me ask it, has the High School Athletic Association given any guidance as far as athletes in sports?
Their guidance is not included in the toolkit, and it is outside the realm of the toolkit. Toolkit is really just for guidance that is in the school day. Remember, we played with masks last year.
Right, but because they're gonna be closer than 6 foot, I'm sure, Friday night. There's no question. I'm gonna watch that football game if they're gonna be further than 6 foot apart, because it's gonna be exciting. How they gonna tackle somebody down 6 foot away from each other?
Be some wide splits.
Huh?
No. What is the guidance for athletes from the High School Athletic Association?
The guidance for athlete, I mean, there's not a mask guidance for athletes at this time.
Okay.
All right.
But in turn, if that football team's all in the locker room unmasked and there's positive in that locker room, or when that team's
You have-
together,
you have
the whole team is
Quarantine.
quarantined for 14 days, knocks them out of 2 weeks of practice, and could be 2 to 3 ball games.
That's right. And just so you're aware, the quarantine guidelines that we discussed in my presentation were for the school day, really an 8 to 3 mindset. It was not reference to athletics. Athletics is an entirely different piece that's governed through the association with that. So those quarantines aren't the same. They're actually more severe. And to Mr. Glover's point, you're exactly right. If you have a close contact, whether it's in the locker room, a close contact from a game, close contact for those, you will have folks that are quarantined for that.
Well, those same kids is gonna be going to school that's playing football, because they can't play football for us if they ain't going to school. And if they're going to school, then there you are exposed again. They're exposing.
Wear a mask.
Oh, okay.
And wear a mask.
Yeah, we're about to move. All right, next item on the agenda is student transfer request. You've got those in your board docs. What's the pleasure of the board?
I make a motion that we approve.
Motion by Mr. Blanton. Second by Mr. Fitch. These are confidential, so there's no discussion. Those in favor of the student transfer request, if you'd raise your hand. That motion carries 9-0. Next is board member comments. Mr. Taylor, do you have anything?
No, other than I do appreciate the discussion we had. We can all disagree and agree on multiple things. That's it.
All right. Ms. Green? Mr. Blanton?
I believe I can let it slide tonight too, because I feel for the people.
All right. Mr. Shores?
Mr. Taylor, tell your dad again, thanks for what he's done. Even though he was a Shelby High and I was Crest, I mean.
You're more welcome to get in that bed.
Okay, we'll talk about it.
Mr. Humphries?
Skipping right over me, was he?
Well, it's going to start down there and come back, but you're okay. Go ahead.
Yeah, again, I'd like to congratulate Kings Mountain High School. That's very, and Mr. Taylor's father for being a great example for academics in sports. Just to clarify one thing from the last meeting, I did say that I'd had a vaccine and I have not had any ill effects from it. And that's just me personally. I'm definitely would never tell anybody to do it, but I'm telling you, just from my experience, I didn't have any issues with the vaccine. So, all right, thank you.
Mr. Glover?
I appreciate and I always look forward to discussion. And, as you said, you asked if I wrote down had that written down, my motion. I try to come here with an open mind every time. I mean, at the last board meeting, I didn't know what decision to make until it was time to vote, and I was still shaky at that time. So, but I appreciate everybody up here on the board and everybody respecting each other and giving everybody the opportunity to talk. And I think a good, healthy conversation and discussion is always good for our board. Thank you.
Mr. Hunt?
I concur with what Philip just said. I do appreciate conversation, the debate, and no matter, if we disagree, we've got to learn to get along and do what's right for the students. And I feel the way that I do, and, spent 40 years in Cleveland County schools, in the classrooms, and I just want to see kids in school, and I just feel like that this COVID virus is, we can better prepare ourselves and the students by putting a layer of protection there, even though people don't like the mask. It's something that's necessary right now. Hopefully down the road, we don't even have to have a mass discussion. But I just feel like that, based on what I've seen and what's coming, there's going to be a lot of kids missing school, and I just don't want to see that.
Thank you. Mr. Finn. Mr. Taylor, do you have something you wanted to add?
Well, let Mr. Fitz, I was going to try.
He passed. So
Okay,
you're on the spot now.
sorry, I was trying to find the Kings Mountain, Shelby, Creston, Burns, their accumulative GPA in regards to the award that Kings Mountain won. That award is named after my father, Jim Taylor, but every coach in every high school and in every middle school, athletics in Cleveland County is above par in more than most counties in North Carolina. But it's not just one individual coach or one individual sport or whatnot. The whole athletic department as a whole, I appreciate the way they put the effort in to make sure that the student athletes know that grades are number one. So I just wanted to touch on that. And thank you, Mr. Shores, for what you said. I appreciate that.
I believe all the averages were over.
We're above
3.0.
above
they were
3.0.
Very good averages.
It's really, really great.
And to run off of that, I think about every year we have a sport running for the highest GPA in the state of North Carolina. Is that right, Mr. Rutherford? And we had one team that won that last year or two or something.
Volleyball or basketball?
Well,
Crest High School had three.
1 year.
One year.
So, right, I just want to add that. I didn't mean to jump, but
That's fine. And I'll just add that it's no secret, and everybody knows this board got off to a rocky start back in December, and I do appreciate the way the board has grown, and we do have healthy discussion, and we'll be friends and share a cookie in there in closed session here in a minute, and hopefully Dr. Fisher brought the cookies, but I do appreciate the board and the time that they put into this study and all the phone calls and emails that we all entertain. So, do I have a motion to enter into closed session? Mr. Shores?
I'll second. I make a motion, we go into closed session pursuant to General Statute 143-3, 18.11, subsections A1 and A3 to enter closed session, discuss confidential personnel matters and consult with board attorney and preserve attorney-client privilege.
I'll second.
All right, motion by Mr. Shores, second by Mr. Blank. Those in favor of closed session? And that motion carries 9-0. All right, we're back to our conference room. Okay, we'll call our meeting back to order. Do we have a motion to re-enter open session?
So moved.
Motion by Mr. Humphries, is second? Second. Second by Mr. Hunt. Those in favor of re-entering open session, if you'd raise your hand. All right, that motion carries 9-0. All right, in closed session, we discussed two confidential legal matters with our attorney, and then we have a couple of recommendations for vote here in open session. First is a Sixth Amendment to the superintendent's contract to extend his contract 1 year, keeping all other terms the same. What's the pleasure of the board? Motion by Mr. Taylor. Second. Second by Mr. Hunt. Those in favor of that motion, if you'd raise your hand.
No. I'll go with.
That was on the superintendent one. Okay.
Well, I was told that I had to vote on both, so.
No, it's just the one. It's two separate votes. Is that a? Yeah. All right. That motion carries 9-0. Then we have a recommendation from the superintendent to approve the administrative contract renewals for our executive team. And that will also keep all terms of their contract the same except for extension of 1 year. What's the pleasure of the board?
Make a motion to approve. Second.
All right, Mr. Fitch and Mr. Glover, those in favor of the contract extension, if you'd raise your hand. Any opposed? That motion carries 8-1. And I think we're down to the good part. Do I have a motion to adjourn?
Second.
All in favor? Go home.